to be alert, and we need to watch. It's always good not to become complacent and to lose our sense of urgency. So I think it's very good to monitor trends and to set thresholds for alerts and resurgences. The National Department of Health has set a figure of 10% change in any geographical area as the threshold for an alert, and a 20% change in any geographical area as the threshold for calling a resurgence, which would then be monitored on a daily basis and can go back down to an alert level or to under control level. So I think what we're seeing is reactions to being this dynamic monitoring and to dynamic thresholding, so that we can know when a particular geographical area is seeing peaks and troughs. But we can also anticipate that there will be peaks and troughs, and that not every peak will be a resurgence. It's just a word of caution, I think, to the public, not to lose their sense of urgency and not to become complacent about social distancing measures, etc.
So 9% increase across the country is just under that threshold for alarm. But the Western Cape, around 42% increase in the last 7 days. And I think the Western Cape, it was the province that got hit by COVID-19 first. So I think we watch what goes on in the Western Cape with particular concern, worrying that it might be, the front runner on perhaps a second wave. How concerned are you about the Western Cape?
Well, personally, I think we should focus more on the rates of infections per 100,000 per population. And if you calculate your indicators that way using your population denominators, then in fact it's Free State and the Northern Cape where I think attention is still warranted, because they are still in the thick of their first outbreaks. So Free State and Northern Cape are still struggling with higher case numbers per 100,000. And Western Cape, as we know, has had its first peak, and that peak declined. And now we are seeing this small rise, nowhere near, levels that were present at the peak, and not yet at numbers that match those currently in Free State and in Northern Cape in terms of numbers per 100,000. So, I think it does depend how we calculate the indicators and which indicators we're monitoring.
And there are so many different measures. I mean, we've learned about the R number, which I understand is the reproduction number of the virus, which you want to keep around 1 or below. Are you able to tell us where that is standing at the moment?
The R number is calculated sort of retrospectively from the case data and the transmission data. At the moment, I think it's standing at around 2 or 2.5 if you look at the outbreak over its entirety. But depending what time period you use, you might get different figures.
I see. Another measure, of course, is looking at what happens in our hospitals, because, you can be infected, but if it's among young people and they don't get it very badly, it's not going to put much of a strain on our hospitals. So the question then is, are our hospitals in certain areas under increasing strain? Are there red flags at our hospitals?
So I'm not aware of red flags, but that is another indicator that is monitored in terms of bed capacity, a number of admissions, and number of admissions per bed capacity. I'm not aware of any red flags at the moment, but we do know that Free State and Northern Cape are still, having active outbreaks.
Yeah, so in other words, as you say, while we're concerned about possible second waves in certain areas, other provinces are still battling with the first phase of COVID-19. I'm just wondering about the deaths, because overnight, I think the latest release was quite a lot of deaths. But we also know that every now and then there's a sort of accumulation of deaths, with certain provinces finally giving in a few days' results. So the death toll, I understand, was over 100 from yesterday. Are you able to break that down for us?
No, I think there are caveats with the death data in that sometimes they are reported in batches rather than per date of death. So I wouldn't like to comment without scrutinizing, the data more closely. But all I have is the total death toll for the outbreak to date, which is at 18,500 deaths. But I wouldn't like to make conclusions based on 1 day's worth of data.
Thank you very much, Dr. Melinda Suchard from the National Institute for Communicable Diseases.